Now we're going to move on to other healthcare professionals, including the levels of nurses and nurse specialties, as well as additional allied healthcare professionals that work within healthcare teams. So we'll begin with Registered Practical Nurse, or RPN, a program that is offered at Niagara College that many of you may be interested in. Now, RPNs provide frontline care to patients. They are largely involved in patient and family interactions, so they're providing that direct bedside support to a patient and giving very holistic care by implementing established care plans. So both a physician with the help of nurses, the registered nurse, or a nurse practitioner will be involved in establishing care plans for a given patient, and a registered practical nurse is going to be involved in carrying out that care plan. They more commonly work in predictable clinical settings, so settings of patients that are more stabilized in carrying out their care plan with the hopes of the patient eventually being discharged. They can perform treatments such as wound care, providing medications, and largely involved in communication. So any changes to registered nurse or the physician who is involved in the care of the patient. So close assessment and monitoring of the patient, as well as communication between the healthcare team and also the patient and their family, is largely part of the role of a registered practical nurse. So providing care that is very transparent and informed in settings of perhaps slightly more stable or predictable patient cases. A registered nurse performs a variety of clinical and administrative tasks as well. They will be involved in assisting physicians, recording a patient's medical history, monitoring the patient just as a RPN would, administering medications, and also performing some diagnostic tasks as well. So RNs can give direct care and take a leadership role in caring for patients with complex medical needs. So RNs complete a 4-year post-secondary university nursing program or college program. So Niagara College also has a honors Bachelor of Science in Nursing program now. And this will allow them to become a generalist registered nurse. Now, all Ontario registered nurses must have a baccalaureate degree, so a bachelor's degree. The program itself will contain theory and clinical instruction in medical and surgical nursing, so an in-depth study of various nursing concepts. RN education is very comprehensive in the biological sciences, in pathophysiology, and in nursing skills, providing a very deep knowledge base and slightly more abilities than the LPN or RPN. But the RPN program also is going to include an RPN training, include biological sciences courses, healthcare assessment, clinical skills. So they really do work very hand in hand with one another, the registered nurse and the registered practical nurse. So the RN is going to perform comprehensive assessments. So perhaps at the start of the day, at the start of their shift, they will perform a head-to-toe assessment to assess the patient and provide any information on changes that have occurred to the physician. They'll develop and evaluate care plans for the patient, administer those medications, and really play a big role in coordinating interdisciplinary care, so involving physicians and other healthcare providers as well. So that communication piece is very, very important for all nurses. A nurse practitioner is an experienced registered nurse who then performs advanced education in the form of graduate training to develop skills and achieve an extended class registration with the College of Nurses of Ontario. So they have a master's degree in nursing, and so they perform graduate school in order to become a nurse practitioner. So they would first have, become a registered nurse, gain enough clinical experience to be able to obtain this graduate education. And the graduate education allows them to practice as a nurse practitioner. Nurse practitioners have independent authority to perform additional activities beyond those available to registered nurses. This includes ordering and analyzing diagnostic tests, communicating a diagnosis, prescribing medications, and initiating treatments as well, and also ordering referrals to other healthcare providers. So they can independently serve as an individual's first point of contact, quite similar to a family doctor within the healthcare system. So they have more of an autonomous authority, essentially, to diagnose, prescribe, and initiate treatments. Now, some nurse classes can also obtain additional certification, allowing them to specialize in a specific area of care. So a nurse may perform additional training or complete additional certifications to work in the ICU, and therefore they would undergo critical care training. They may also do additional training to be an emergency room nurse, or work in cardiology units and work in cardiovascular care. So depending on the specialty and in areas that require additional expertise, for example, critical care pediatric, as we've said, health diseases or diseases and conditions in children present slightly differently. And so this requires a unique skill set. So specialized nurses are able to treat more specific populations of individuals with a unique care requirement. And for more information, this website through the Canadian Nurses Association gives details on these additional certifications. So nursing is a excellent field in being able to grow your profession, expand your knowledge basis, and work in various areas of medicine. So let's discuss the interprofessional team. So other healthcare providers that are part of a healthcare team. So we'll start with pre-hospital and emergency response with our paramedics. So paramedics are going to provide rapid assessment, stabilization on site. So this could be in an individual's home where paramedics have gone to retrieve a patient. This could be even roadside in the case of a car accident. So they can perform emergency interventions in the pre-hospital setting. Many different types of assessments, assessing vital signs, rapidly triaging to determine any specific on-site needs of the patient and evaluating the extent of trauma. They can perform interventions such as managing airways, providing oxygen support, beginning IV access, and also providing emergency medications. And of course, they're largely involved in the transport, so stabilization of the patient so that they can be safely transferred to hospital, and communicating with the individuals upon arrival to the hospital. So clearly communicating with nurses and physicians is extremely important to provide the specific and rapid needs that the patient may require in an emergency setting. Now, rehabilitation and movement specialists are professionals who are involved in mobility, pain management, biomechanics, and functional recovery. So this could be after an injury. This could be associated with rehabilitation as individuals age, and the many functional limitations that come with aging, physiotherapy or chiropractic support, can help to improve a patient's mobility. So they will play a role in chronic pain management, athletic rehab after an injury, or workplace rehabilitation even. So we have physiotherapists. They will work in hospitals, clinics, and rehab. Physiotherapists are very largely involved in rehabilitating patients following anything from injuries to something like a stroke or brain injuries. So these individuals work very closely to analyze movements and also be able to aid in patients' recovery. So I'll jump to kinesiologists. So kinesiologists focus on biomechanics, movement analysis, and also exercise prescription. So they are largely, and the majority of kinesiologists will work in the community in rehab and fitness settings. So their key contributions include injury prevention, return to work conditioning, so physical conditioning and functional strengthening, and optimizing physical performance. Now, a chiropractor is going to be associated with focus upon spinal and musculoskeletal care. They mainly will work in private clinics. So a chiropractor will largely work independently or within a clinic with additional chiropractors or physiotherapists or massage therapists, in particular treating musculoskeletal injuries. Now, podiatrists or chiropodists are specialists of the feet and lower limb care. Now, this is very important in providing interventions for nail and skin care, providing or prescribing orthotics, assessing gait of an individual or walking, and also diabetic foot monitoring. So complications of diabetes include, and they can lead to diseases or disorders of the feet, so chronic foot deformities or infections. And so podiatrists and chiropodists, podiatrists will be involved in treating that. Also mobility impairment that involves the feet. So they'll work in clinics, outpatient and specialty practices. So a little more details. Again, I already discussed physiotherapists, but they, again, will work in hospitals or in clinics directly with patients. In hospitals, they are very involved in the discharge of a patient. So before a patient can be discharged, they will be assessed by a physiotherapist to ensure that they can safely transition back home and perform tasks of everyday living. This is especially important for seniors to reduce the risk of falls during the discharge and transition back home. So they'll be referred to post-injury, post-surgery, in response to mobility loss, or with chronic pain affecting function. So they can provide therapeutic exercises, manual therapy, again, rehab as well. So physiotherapists can specialize in post-surgery, so involving muscle strengthening and conditioning, or also neurological rehab. So after a stroke, helping individuals if they need to relearn the ability to walk and to be able to retrain these aspects of physical functioning. Again, chiropractors mainly focus on spine and joint function, so manual adjustments and spinal manipulation, as well as some soft tissue therapy. So just as a summary table and comparison of scope, so physiotherapists are going to focus on whole body mobility through rehab, exercise, and manual therapy, and they are highly integrated in the medical system, working in hospitals, involved in discharge plans and post-discharge plans for patients as well. Chiropractors, again, spine and joint manual adjustments. Kinesiologists are involved in movement mechanics and are very exercise-based, so prescribing exercise to individuals based on their specific mobility requirements, and their level of medical integration is variable. They'll work in clinics, as mentioned previously. And podiatrists, foot and lower limb. Treatment can be medical and mechanical, so mechanical in terms of mobility, but also medical in cases like diabetic foot, or if there are any maybe chronic conditions affecting the feet. Our pharmacists provide clinical support and medication system support. And there are some other individuals in this category as well. The first being pharmacists, specializing in medication management, ensuring safe, effective drug therapy, reviewing prescriptions, checking for drug interactions, and educating patients on proper medication use. So again, this communication piece is so important at every level of healthcare professional. For pharmacists, accurately educating patients on the proper uses of medications and monitoring for any potential side effects. Pharmacists may work in a hospital, providing the medications that doctors and nurses will treat patients with. Community pharmacies, long-term care facilities, even in clinics. So they play a role in that medication safety and education piece. So here we have another checkpoint. Now this is going to expand kind of the specialist involvement that we discussed, and we are going to focus on or think about the allied health providers that would be involved here. So an 83-year-old experiences a fall at home and fractures their hip. They're brought to hospital and undergo surgery. Continual rehabilitation is required after discharge. So I'd like you to pause the video again and consider who may be involved in the care of this patient. Okay, so we'll begin with this individual is brought to hospital. So I would imagine, especially if an elderly individual experiences a fall and say is found on the ground, the most important thing a family member can do is to not touch the patient. So leave the patient where they are and call 911. Allow the paramedics to properly move the patient. Moving a patient who has experienced a fall at this age could cause further damage if not done properly. So paramedics will come and they will work to safely transport the patient from home. Upon arrival, again, the emergency room nurse is going to triage and provide any acute care as well. The emergency room doctor will assess. And in this case, the individual requires surgery. So they will interact with the operating room nurse. In this case, an orthopedic surgeon will be performing the surgery since it involves a fracture of the hip. So an orthopedic surgeon will provide surgery involving skeleton. Radiologists would have reviewed the imaging to confirm the fracture of the hip. And being that they are 83 years old, they may require an extended hospital stay. So they may be placed on on a medicine floor or in a medicine unit, where likely an internal medicine doctor who works on the medical floor will be involved in their recovery. So this inpatient recovery process, as well as any after their surgery, recovery room nurses and so forth. But during this extended stay, as they're seen by an internal medicine doctor, they may also be visited by a geriatrician. So the geriatrician may visit and determine maybe a potential cause of their fall, maybe discuss and assess their overall health and wellness to consider other community care that may be beneficial to the patient. Physiotherapy will certainly be involved to aid in the rehabilitation and strength of the patient after they have recovered. A geriatrician may even, suggest additional support such as a psychologist, depending on how they assess the patient's mood based on their now reduced mobility at their age. They'll then be discharged, and in the community, they will likely continue seeing a physiotherapist for mobility and gait training, an occupational therapist who we'll talk about soon to see maybe why they fell at home and determine any other fall risks in the home to help them get around their home safely as well. possibly a kinesiologist for that structured strength rehabilitation, maybe chiropractor, not typically first line in acute fractures, but certainly a physiotherapist for that retraining. So we can see this continuum of care from initially being brought to hospital to community care that is involved. Additional clinical support and system supports. Another provider here that we have is a physician assistant. So physician assistants are licensed healthcare professionals who work under the supervision of physicians, and they can assess, diagnose, and treat patients. They can order and interpret tests and prescribe medications. So they typically will work in outpatient clinics. They can also work in hospitals and even in specialty practices or community health centers. But the key is that they will practice under a supervising physician. Respiratory therapists support diagnostic accuracy, also life-sustaining interventions. So they specialize in evaluating and treating patients with breathing and cardiopulmonary conditions. So they'll manage things like airway support, oxygen therapy, mechanical ventilation. So if a patient is ventilated, then the respiratory therapist will monitor the machinery and also monitor the patient and administer any respiratory treatments for patients with conditions like asthma, chronic obstructive pulmonary disease, pneumonia, also those recovering from surgery or critical illness. So RTs have a very wide scope, specifically relating to supporting respiratory function. They work very closely with doctors, nurses, and other specialists to stabilize patients who have difficulty breathing. So in this photo, we can see respiratory therapists involved in intubating a patient. So inserting a tube down their airway to assist in individuals who can't breathe on their own. So they will work in hospitals, especially emergency departments and ICUs, so intensive care units. They can also be a part of pulmonary rehabilitation programs. So ICUs mainly work in critical settings, RTs mainly work in critical settings such as ICUs. Now, in addition to the providers that we've just discussed, there are also professionals who are involved in functional support and community-based care, in addition to those discussed above. So these professionals focus on functional recovery and support within real-life environments, not just in those acute medical settings. So the individuals that we're going to talk about on the next slide play a key role in helping patients function independently in daily life and within their communities. So they aid in patient independence, daily functioning, supporting quality of life, mental health stability, and community and family-centered care. So delivering care that extends beyond the clinic and involves support systems and a real-world environment. So creating and establishing a involved support system for the patient after they have left hospital. These professionals include occupational therapists, registered dietitians, healthcare aides, midwives, and psychologists. So occupational therapists help people regain independence in their daily activities after injury, illness, or disability. So they focus on activities of everyday living. We can see this individual is working with an occupational therapist to perhaps help them navigate a new disability and to be able to reach things from a cabinet in a different way. So they often work with patients to allow them to or help them to function in everyday life, working with patients after strokes, after surgeries, brain injuries, or chronic conditions. They essentially will modify tasks, recommend any adaptive or supportive equipment, and help work to improve functional movements. So they can work in hospitals, rehabilitation centers, community clinics, and can go out into the community to assess a patient's home and their current living condition to determine how to adapt their environment to better suit their needs. A dietitian is going to specialize in nutrition and medical nutrition management. So they assess patients' nutritional needs, develop meal plans for specific conditions such as diabetes, kidney disease, or heart disease. These diseases require special diets. So in the case of diabetes, a very low sugar diet, or in the case of heart disease, modifying the diet to include lower levels of fat or cholesterol is really important. So dietitians are critical in as part of the discharge plan for a patient in order to properly educate them on how to support themselves once they leave the hospital in the healthiest way possible. Now, a healthcare aide provides direct patient support with daily living activities. So healthcare aide or personal support worker, PSWs, they assist with tasks like bathing, dressing, mobility, feeding at home. So they may work at home, but in patient homes, but also they work in the hospital, long-term care facilities or assisted living facilities as well. So they provide really hands-on daily support and are often part of the frontline care team for these patients. A midwife area of focus is maternal and reproductive care. So they specialize in pregnancy, labor and delivery, and also postpartum care. So they will monitor pregnancies that aren't high risk. So they can provide prenatal education, assist actually directly in delivery, and support families and moms after birth. They tend to focus on more holistic and patient-centered approaches to reproductive care, but they can practice in hospitals, in birthing centers, or can be present during home births as well. And finally, psychologists assess and treat mental health conditions using therapy, psychological assessments or testing, and behavioral interventions. So they do not typically prescribe medication unless they have additional qualifications, but they can provide counseling for depression, trauma, etc. They also often conduct research and again can perform psychological assessments to aid in the diagnosis of certain mental health conditions. They can work in hospitals, in clinics, they can have their own private practice, they can work in even schools and university settings, colleges, and in rehabilitation centers. So these individuals, again, support the functional, supportive, or community-based aspects of care for patients. Now, as we can see, patient-centered care involves many facets, and we can see that care is very collaborative, very coordinated amongst healthcare professionals, and top priorities include physical comfort, emotional well-being, and therefore we need to address all facets of an individual. We need to address their emotional health, we need to address their physical health, and we also need to consider things like patient views and the family views and ensure that patients feel respected and valued. So the many professionals that are involved in healthcare, many medical specialists aim to provide a very holistic care that supports all patient needs in a transparent and effective, efficient setting. So to summarize our unit on medical specialists, we can see some kind of three main areas here. So as we know, care is very organized by role and scope. So the roles of physicians and various specialists in diagnosis and managing complex medical conditions. We went over various different types of specialists and what they do, but also where they work. So what specific units they may be working in, and what diseases they treat. We saw the different levels of nurses and different specialties within nursing as well. And we looked at the allied roles. So this included specialized professionals that extend care beyond acute treatment, so involving rehabilitation and community settings. And finally, we talked about how important collaboration is in healthcare to improve patient outcomes. No, professional functions independently, and comprehensive patient care requires this very coordinated teamwork across disciplines. So if you have any questions about this week's material, please don't hesitate to email me. I'm also going to open a discussion board where you are welcome to ask questions, or also you can provide your answers to any of the practice problems that were in this lecture, as well as to the matching question if you wish, and can discuss with one another. But yeah, if you have any questions, reach out at any time. Take care.